also partner with other like-minded organisations and charities with common values and aims. We're a founding member of the VI Charity Sector Partnership, a collaboration of charities working together for similar goals. This includes local sight loss organisations through Visionary, RNIB, Guide Dogs, Macular Society, Glaucoma UK, Thomas Pocklington Trust and Blind Veterans UK. For example, through the partnership, we're working on a sight loss pathway. Our involvement, which has included consulting with members of our community through our local peer support groups, means that we can ensure any pathway is reflective of the unique experiences of those who live with inherited progressive sight loss. I'm delighted to welcome Rob Cooper, NHS Strategic Partnerships Lead at RNIB, to explain more. Thank you, Rob.
Thank you, Paula. Good to see everybody again. My second day, actually. I was here yesterday. So yesterday we focused very much on the pathway and our clinical pathways and how we can improve those clinical pathways to ensure that support is embedded into those pathways. You've all probably been on a journey to get to where you are today, especially those who have got a sight condition. You've been on probably a clinical pathway. Did you know you was on a clinical pathway? Did you know there was a starting point, a midpoint, an end point? Probably not. Because the problem is, the NHS and social care colleagues are not very good at articulating those pathways to us, the public, because they're very much medical-based pathways to ensure that you get the appropriate treatment, which is great. But the challenge is, we know people need more than just clinical input. We need support, we need help, we need advice, we need people to help us on that journey. It's lonely trying to navigate it on your own. So we've really been starting... Oh, are my slides coming up? Is there some slides or... Sorry. No slides today? It's coming. Sorry. So you've all been on a journey. And that journey often relies on hope. You hope a clinician may tell you about Retina UK. You hope a clinician might give you some leaflets and information. You hope that somebody will tell you about a local support group. We can't rely on hope. We need to make sure that support is embedded into all our pathways, into all clinical pathways. And that's what we're trying to do in collaboration with the VI Charity Sector Partnership. We are trying to get away from hope so that it becomes the norm that people get support from charities like Retina UK, RNIB, Macular Society, Guide Dogs. Wherever they are on that pathway, we hope that you get the support to help you on that journey. Because you don't know what you don't know. Information is powerful, knowledge is powerful. So we've been collaborating across the UK, and a special thanks to people in this room who've engaged with our consultation exercise around the pathway. So you've been telling us your stories, your experiences. Some good, mostly bad. We heard it yesterday. It was like being hit with a brick. That's not good, is it? So we need to try and make sure that those pathways are fit for the future. And actually, we don't need a pathway, hopefully, in the future, because all our pathways have just got that support embedded. So we've still not got slides, so I'll keep going. Sorry about that. So why do we need a support pathway? R has a rare genetic condition. At the age of 16, she was told she had RP and was going to go blind. She was left with nothing. There is a lot of information and support out there, but she didn't know where to start. The group, this is one of the groups, so we consulted with about 8 groups. So the group said, the group felt it was really important to find out where the specialist hospitals are for retinal conditions, as the local hospitals can't always provide the right testing, and that genetic testing is very important for hereditary conditions. When diagnosed with a retinal condition, people need information and support to help them prepare for losing their sight. It would be useful to talk to people who have already been through it and are living well to show it can be done. People need to prepare and get ready for what is to come. Still no slides. We'll keep going. So, why else do we need to ensure that our pathways are also designed for you, the layperson? We have a real problem in the UK around health literacy. There is a crisis, actually, in adult literacy that directly impacts on people's health. In the UK, 7.1 million adults read and write at or below the level of 9 years of age. I did some work 10 years ago in a northwest city. We produced some materials. We had to pitch that at a 6-year-old, not 9. 43% of adults do not have adequate literacy skills to routinely understand health information. 61% of adults do not have adequate numeracy skills to routinely understand health information. There is a crisis around health literacy, and we need to change that, and we are trying to do that with the work that we are doing on the support pathway. I'll keep going. In collaboration with the NHS England, we're here. Collaborate for good. We collaborated. We got there. Okay, so some of the work, we've been collaborating with NHS England. As Paula said, I've been the strategic lead to the NHS for RNIB, but very much pulling the third sector together so that we can engage with NHS partners, with social care partners, to really start to understand how we can transform our pathways. We identified in one piece of literature 109 pain points across that end-to-end pathway. That's a lot of pain that we need to try and address. Some of the research we did with NHS England looked at what are some of the specific problems around our eye care pathways. The problem is that navigating the pathway is complex and confusing for patients. The problem is that support is not person-centred. The problem is that patient support is not triggered automatically or built into all the pathways. The problem is there is no formal links to support services. We hope somebody has knowledge to share with you. The problem is that there is lack of funding for support staff, as they are not part of core funding of services. The problem is that the support that does exist isn't distributed evenly across the pathway. The problem is that support that does exist is not given consistently to all patients. Again, we are reliant on hope. We hope somebody will give you information so that you can take control. It might sound doom and gloom, but we have to start somewhere. And that's what we've been doing over the last couple of years. We've been collaborating to really understand what we need to address and how we can change our pathways for the future. It can be done. 12 years ago, I was involved in some work around the lung cancer pathways, COPD pathways, around really trying to get patients to better understand lung cancer and COPD and the support that is available to them, but also to understand what that disease or that condition looks like from a layperson's perspective. Those pathways don't really exist anymore because they're just embedded. The cancer pathway, anybody who's diagnosed with cancer now gets support, more or less. You know, it's just embedded into the DNA now of all those pathways. When I first came to post, I analysed a number of our clinical pathways that NHS England had developed on the back of COVID and the transformation programme. We were lucky if they mentioned ECLOs. We were lucky if they mentioned other support services like ourselves. We were lucky if they even mentioned the social care support that people need around certification, registration, welfare benefits. That's what we're trying to address. So, what does it look like at the moment? There's a disclaimer on this slide because it is still very much working. We are still developing this. We are still consulting with key professional bodies to get this pathway right. So what we've got on the screen is a bit like the London Tube map. It's a great map. It's like the Circle Line. We've got stations, but we know the pathway end to end. There's about 15 different stages across that pathway, but that's not easy for a layperson to understand. So we've boiled it down into 4 key stages: having my initial appointment, having my diagnosis confirmed, support after diagnosis, and living well with my condition. And then we've got some waiting well sections, because we know at the moment the NHS is in crisis. People are waiting longer to access treatment, to access care, and that's going to be around for a long time. So we need to try and address waiting, and how do we support people while they're waiting? How do we give them good information while they're waiting, so they're not just waiting for that next appointment, they actually can be in control through information and knowledge. But what's really important about this pathway is some of the key areas of support that's been identified by over 400 people with lived experiences who've been engaged in this process. They said, we need to understand the eye care journey. We need to understand that journey so we can be an active part of it and not just being done to. We need to understand the journey. We need to understand the diagnosis. What does that mean to me, my family? We also need to have a good understanding and access to the emotional and practical support that's available to you. So that's what we're trying to do. But that's just a generic, hypothetical pathway that the majority of people in eye care go through. The challenge we've got is that the NHS run on specific individual clinical pathways for each condition. So we need all of those pathways to reflect the support that people are asking for. It's going to be a 5 to 10 year piece of work. So what came back specifically from the engagement with yourselves? That you have access to specialist eye care team, genetic testing, counselling if appropriate. I know that genetic testing is available to me and I've been referred for genetic counselling if required. I understand the next steps and how my condition will be treated, managed, and whether treatments are available. I have opted for genetic testing. I may know my genetic diagnosis. I have been given specific eye health literature from a trusted source. We can't rely on Dr. Google. We need trusted information at the right point on your journey. You need to understand if my condition is hereditary and what that means for me and my wider family. We need to know about research. What future research is happening to help me? What clinical trials are available? And I need to understand how my condition may develop. And that's feedback that you've given us in this process. So we're listening, because we want to transform our pathways so that people are not reliant on hope, that you are empowered, you are informed, you are able to take control, you are able to actively participate in your journey. You're not being done to, you know. And that's what we're trying to do with the collaboration that we're doing across the third sector to really ensure that we build pathways that embed support, information, advice and guidance for you, so you have better experiences. So where are we at? So we've got the pathway document. We're working with a group to pull that story together around that pathway so that hopefully by November we'll have a version for our professionals, our clinicians, so that they can really endorse it and take it forward. We will then be turning our attention to a lay version, one for you and the community, so that you can really take those pathways and understand what you should be getting, so that you can be a self-advocate. You can ask, why am I not getting this support? I should be getting this support. I should be getting a certification. I should be getting welfare benefits. I should be getting rehabilitation support. So that's some of the work that we're doing at RNIB collaborating with yourselves and other VI charity sector partners, but then also the Royal College of Ophthalmology, the College of Optometrists, AOP, ABDO, FODO, Clinical Council. So I'm just really proud of the information that we've got from you. So I just want to say thank you to the Retina UK team and everybody in this room who's been engaged in this process, because you are going to shape our pathways for the future to make sure that people don't necessarily have the same experiences that you had. Thank you for listening. My name is Robert Cooper.
There you go. So taking the slides there.